Adams State College. Great stories begin here.
Good evening, everyone, and welcome to this evening's ASC faculty lecture, the last one for the fall semester 2010. Tonight, it is my pleasure to introduce from the Department of English an assistant professor, Dr. Sarah Owens. Her specialty is medieval literature, and tonight's talk with the fascinating title, Bursting Brains and Laudable Pus, is actually a presentation she's given to a medievalist conference. And this is going to be a, for the layman's version of it that we can all enjoy. She assures me it's going to be fun. So please join me in welcoming Dr. Sarah Owens.
Thank you. As Robert said, this is a paper that this is a topic I've presented on before, most recently at the Arizona Center for Medieval and Renaissance Studies conference last February down in Tempe, Arizona. And this is something that's being revised for publication very, very soon, hopefully, if all goes well. It comes out of a larger project, which is my specialty within medieval literature, and that is medieval drama and medieval medicine. Now, you might think at first thought, well, what the heck do those two things have to do with each other? I get that a lot, and the way that I try to explain it to most people is to say, well, you know, I got into medieval studies because I was interested in old cultures. I was interested in particular in Chaucer when I was in undergraduate schooling. And then when I got to graduate school, I developed an interest in medieval drama. And I started to notice that there's a huge emphasis in the medieval plays on the human body in all of its different forms. Putting it on display, dismembering it, violating it in numerous ways, including probably most spectacularly in the Crucifixion plays in which Jesus is crucified on the cross. And all of those presentations of the body seem to be very spectacularly corporeal, okay? So focusing on the physicality of the human body. And as I started to do research into that physicality, I started to notice a pattern. And that was that the language that's used to describe the bodies in the medieval drama has a very similar pattern to the ways that medieval medicine describes the human body. So I said to myself, well, okay, maybe I'm just being crazy here, but maybe I should look into this a little bit further and see if there really is a pattern going on, or if it's just my brain kind of being weird. It has a tendency to do that. So as I went through my research, getting ready to do my dissertation work, I found that there is, in fact, a parallel emphasis on the corporeality of human bodies in medieval medicine. And there is also, as far as I see it, an emphasis on the visual presentation of the body in medieval medicine. So what I'm going to be talking about today in particular is this weird title, Bursting Brains and Laudable Pus, has to do with putting the bodies on display in medieval medical manuscripts and in medieval dramatic manuscripts. So I'm going to show you some interesting slides, hopefully interesting slides, that show you bodies in interesting and gruesome, grotesque positions. And also I'm going to make the case that this emphasis on the visual representation of the bodies has to do with a larger trend at the end of the late Middle Ages that has to do with the value of seeing the body in all of its messy corporeality. Okay, so that's where we're starting from. So the spectacular economy of flesh and fluids in late medieval drama and medicine has to do with the values of those flesh and fluids. So let's start a starting point. One of the things that's claimed about Renaissance medicine that kind of bugs me as a medievalist is that people in the Renaissance were the first ones to really do dissection, or they were the first ones to do truly accurate medical illustrations. So when I was doing my research for this project, I started to think, well, is that really true? Or were there dissections going on in the Middle Ages? Were there medical illustrations of the body going on in the Middle Ages? Okay. This particular slide is the cover of a book of the medical tome of Vesalius. I don't know if you can see the details on this, but this is basically a surgical theater. And this is supposed to be Vesalius right here performing an autopsy dissection on a human body with all of the medical students looking on there. And the claim is, for the most part, by Renaissance scholars, that it's people like Vesalius who, in the Renaissance, really started the trend of dissection, especially public dissection for medical purposes. But yes?
It seems like I think Leonardo da Vinci was famous for...
Yes, for also doing
was he
dissections.
before this person or after?
They're roughly contemporary. Yeah, it is actually a trend in the Renaissance that public dissection becomes a very popular means of looking at human bodies. That I am not disputing, okay? But I found in my own research that in fact dissection for medical purposes was done very much prior to the Renaissance. So I'm going to talk about that a little bit as well. This is just another illustration that's a pretty famous one from the Renaissance period that kind of emphasizes the human body and in this case the skeletal system. We've got a skeleton who's thinking about his own mortality, which is kind of ironic actually. But this is the type of illustration that's fairly common in the late Renaissance that tries to lay out the human body in its various systems and tries to display it in ways that we can understand kind of as lay people, as opposed to the previous slide, which was specifically for medical students, that surgical theater there. So this is a Renaissance illustration. But okay, one of the things that I found is that dissections and pictorial representations of those dissections are actually quite common in the Middle Ages. In fact, as early as the 13th century, it became standard practice to have dissection as part of medical training, at least on the continent of Europe. Not necessarily in England. It came to England a little bit later. My specialty area is English literature and English medicine. For the most part, what we have in England around the 13th century and 14th century are descriptions of dissections rather than actual illustrations of dissections. But one of the things that I found in looking at the dissections that are common in the Middle Ages is that we have a lot of manuscripts that give us some sort of visual of that, although we may not have an explanation for why the dissection is happening. But we are having a dismemberment of sorts that appears fairly common in a lot of medical texts from about the mid-13th century on. Becomes more common in the 14th and 15th century, which is still very solidly in the medieval period. So this particular illustration is actually of a C-section. So, yeah, it is. It's not a dissection per se, but it is an opening up of the body of a living body, which is prohibited by the church in the Middle Ages, but was still practiced in the Middle Ages. For the most part, though, we aren't talking about doing much surgery other than amputations. Now, we're not talking about, what is it, Theodoric of York from Saturday Night Live, the whole, who's the barber surgeon here? You guys know that joke with the, okay, never mind. If you're not feeling the 1970s Saturday Night Live reference, I can't help you there. Okay, I should have put a video into that. That would have been great. Okay. So here we have another opening up of the body, and this is, in fact, a dissection. So this is a dead body, not a live one. And as you can see, there is kind of the elements of the surgical theater going on here. We have some scholars in their robes here who are also church figures because in the Middle Ages, if you were going to be trained at university, you were also training for religious orders. So in order for these people to be part of a medical faculty, they would have also have been priests. So they're looking on and they're watching the dissection going on there, and it's laid out on the table. And it's putting the body on fairly gruesome display right there. And we are being asked in this manuscript to look at that body being dissected and taken apart into all of its various parts. Something else that comes out of the medieval tradition of dissection is that the autopsy for legal purposes becomes more and more popular toward the end of the Middle Ages. So starting around the 14th century, leading into the 15th century, we see a lot of autopsies happening to determine the cause of death. And again, this is something that a lot of people think comes about much, much later. But we start to see legal texts talking about looking into these bodies, maybe bodies that had been, people that had been murdered, trying to figure out how they had been murdered. Also bodies that maybe, or people that died from mysterious circumstances. They would open up those bodies and try to figure out what was happening. And as a result of this increased popularity in autopsy, we have what became the standard way of cutting open the body, which is still with us today, which is that Y incision. So if you go to a funeral home and you look at the body being opened up for an autopsy, very often you're going to see that Y incision, and that it needs to be sewn back up. So that actually comes about in the Middle Ages rather than later. So it's been with us for quite some time. Okay. So one of the things that I started to notice, and then confirmed through research into what other people had done with medical illustrations in the Middle Ages, one of the things I noticed is that the illustrations that we have out of medical texts don't look at all like what we're used to in terms of medical illustration. If you look at a modern medical textbook and you look at the way that the body is laid out, whether it's a drawing or a photograph or anything like that, you're going to see much more realistic presentations of the body than you're going to see in a medieval manuscript. So this is where Renaissance scholars are, in fact, on the right track, and I can't believe I just said that. I don't see any of my current students in here, and if they were here, they would probably fall out of their chairs that I just admitted that the Renaissance scholars are right about something for once. But one of the things that the medieval texts get criticized for is that they're not really accurate. Right? They don't show the body as it is. It doesn't show it in a realistic sense. Okay? We're not looking at a documentary type of illustration. The reason for that is that that's not the purpose of the medieval medical manuscript. Okay? The medieval medical manuscript is trying to help the practitioner of medicine understand how the body works. Now, in order to do that, you don't necessarily need to know exactly where all of the parts are. You just need to know how they work together, how the systems work together. Okay? I'm going to talk in a little bit as we go forward about the theory of the humors. Okay? And this is one of the major bases for medieval medical understandings of the human body, is how do the four humors work together. If you can understand those things, if you can understand how to balance the body through your diet and through your environment and things like that, you don't need to know exactly where the liver is and what the liver looks like. Okay? So when we're talking about illustrations that are putting on display the human body, even the interiority of the body, you don't necessarily have to show it exactly as it is. Okay? And that's why I've put accurate in quotation marks here. This particular illustration is of the circulatory system. And so what's happening here is you can see, well, hopefully you can all see with the lighting in here, you can see the veins and arteries in here, and they're going through the body. It doesn't look like a modern illustration of the circulatory system. Okay? I mean, it kind of approximates it, right? I mean, there are lots of blood vessels going on in here. There are quite a few going on in the head. That guy's head looks kind of weird, but whatever. We do have the heart in here, and we see that the blood is moving through the body. But it doesn't look like a documentary type of picture. But that's not the point. Okay? The point of this particular picture is just to show you that the blood is important to the body, and it's important to the functioning of the core of the body. And so you see more the emphasis on that core and what's going on there than you do the actual individual veins and arteries and things like that. Okay? So when we're looking at medical illustrations from the Middle Ages, we're not necessarily looking for something that we would recognize as a medical representation of the human body in modern terms. Okay? All right. So what exactly do these things tell us? Okay, if we're going to look at medical illustrations from the Middle Ages, what in the world are we actually looking for? Like I said, one of the things that we're looking for is just how the body works and how the systems work together. Okay, they understood the systems differently than we do. Okay? Harvey didn't discover the circulation of the blood until quite a bit after the end of the Middle Ages. Okay, so people didn't quite understand exactly how it worked. They knew that the blood pumped through the body, they knew that the blood was important to life, but they understood it more in terms of how the blood interacted with the other humors in order to make you healthy or unhealthy. What we see in this particular illustration is something out of a medical text, but it's astrological points. This is a zodiac person. Okay? So we have a human body with the different zodiac signs in here and how the zodiac signs correspond to various parts of the body. Okay? So in order to understand how medieval people would use this particular illustration, we would want to look at what exactly they're pointing to with these various things. What's happened here, in case you're wondering, is that in the Renaissance, when people started to think that medieval people were all backward and all of that, a lot of the manuscripts were either destroyed or mutilated in some way, and so the private parts have been scratched out here. So what we see here is that the sign Scorpio corresponds to this general area of the body. Okay, so when Scorpio is in the sky, then that might be a time when that part of your body might have problems, or when you would want to address those types of issues. Okay, so that's what's happening here. Is you can see that the different signs correspond to different parts of the body, and you would want to treat them at a specific time of year, or treat them when one of the planets was in alignment with the zodiac and all of that kind of thing. So from that, we can see, okay, it's a different type of medicine than what we're used to. Okay? Yes?
Why is she standing up for this, or do you know what that?
Pisces. Pisces. Okay? Pisces corresponds to the feet. Okay? So my feeling on that would be, based on what I've read and seen in the other texts, is that during the month of March, that might be when you experience foot problems. Okay, so then you'd want to address those foot problems during the month of March. Okay, does that make sense, Jimmy? Okay. It is supposed to be a guy. It does look like a woman, doesn't it, with the long hair? Zodiac man. It's not zodiac woman in this case. Anyway, so what this tells us is that the way they understood those systems is different from the way that we understand those systems. And part of that is just that, obviously we have had medical advances. We understand a little bit more about the interior of the body and how it works exactly. And we have had, live surgery and live vivisection and things like that, which they didn't really practice that much during the Middle Ages. So they had to understand those systems in other ways. Okay, here's another illustration of a zodiac person. The zodiac signs maybe aren't quite as clear on this. But again, we see that the various parts of the body correspond to the different zodiac signs. As they're going around there. Past this. The other thing that I really started to notice when I was getting into my research on this was that in the medical texts, the way that we look at and understand the body, the way that we assess the value of the body and the health of the body, has a lot to do with looking at, examining in depth flesh and fluids in various forms. Okay? Looking at the body as a whole, Okay, we're going to do a general assessment of how this person exhibits their humoral composition. Okay, we're going to look for particular symptoms that might correspond to an imbalance in the humors. But we're also going to look at different body parts, right? What's going on with this person's hand, okay? What's going on with the fluids in this person's body? Urine analysis is a big part of medieval medical practice, as it is now, right? You go, you give a urine sample, and then the doctor takes a look at it. Well, instead of doing a chemical analysis, like we would today, what a medical doctor in the Middle Ages would do is they would look at, examine, scrutinize your urine and try to determine what the heck is wrong with you. Okay? This particular illustration is out of a medical textbook, and it's trying to explain how the different colors of urine can correspond to various illnesses. Now, this is something that still goes on today. I mean, if you go to the doctor today and you give a cloudy urine sample, they're going to say you have protein in your urine. Okay, what could that be? Right? What they're doing there in the medieval medical practice is they're saying, okay, you can have, kind of clear urine. You can have, I don't know what the blue urine is. That probably is not good, would be my guess. Obviously you've got, maybe blood in the urine in a couple of these, and that's not good, right? And then in kind of the normal range, we've got, various colors, shadings going on there. These texts that show the colors of the urine also describe the viscosity of the urine. They talk about, whether or not it is a cloudy urine sample. One of the ways that medical practitioners in the Middle Ages could assess the urine is also by smell and by taste. Okay, so they'd take a little sniff of that urine and see if it smelled a little off, right? Now, in order to do that, you'd have to, have a pretty wide experience with normal urine, right? But this is part of normal medical practice at the time. So a medical practitioner would know right away, I'm going to smell that pee, and I'm going to be able to tell you right away, this person's got a kidney stone, okay? The tasting of the urine. This is something that seems very bizarre to us, but it is part of an ancient medical tradition of, really getting in there and examining the fluids and excreta of the body. So you can imagine there are other things that we excrete from our bodies that they'd be interested in as well. And there are other illustrations, I don't have any with me today, of what you can do with poo, what you can do with sweat, and also blood. I'm trying to think if I have the blood color wheel on here or not. Can't remember if I put that one in. But one of the really common medical illustrations at the time, in addition to the urine color samples, which actually makes me think of paint color samples. Like, let's look at our color wheel and crisscross the colors and match them up. But is the color wheel of blood, and so how that would be used by medical practitioners is to take a sample of blood through bloodletting. Okay, generally a vein in the arm, as with today, right? And then you would look at, again, the color, probably the smell of the blood, the taste, the viscosity of it, all of that kind of stuff. And all of these things are described in great detail in the medical illustrations. So through that, we can see that the assessment of health is going on through the evaluation of these flesh and fluids. So again, the whole body, right? Maybe then looking at an individual part, maybe a part that's giving you trouble, and then looking at some of your excreta to see if there's an underlying cause that wasn't visible by examining the entire body. Okay. All right, so this one is actually this one's a urine color wheel as well. And the writing isn't very clear on this one. I'm pretty sure this one's in Latin. But again, you can kind of see that there's a range of colors going on there, probably from, relatively healthy, but, a thin stream going on there. Oh, that's something else I forgot to say. Right. The viscosity of the urine is important, but whether or not your stream is weak or strong or anything like that would have been considered in that as well. So we see on here the color scheme getting darker and all of that. So probably down here, you're probably about to die, would be my guess, if your urine looks like that. If your urine actually does look like this, you really should seek medical attention, honestly. It doesn't take a medieval medical practitioner to tell you that, but I'm just saying. Okay. Probably means your urine's full of black bile and you really are about to die, honestly. So, anybody going to jump up and run out right now? No? Okay. So here's another one. This one's probably a little bit clearer, but again, we have the range of colors, and the practitioner in the middle here is holding up the jar, the Jordan of urine that the young man has brought him, and he's probably trying to figure out what's wrong with this young guy. I can't tell from looking at him if he has the pox or not, possibly. Okay. All right. So all of this examination of the entire body and the flesh and fluids comes out of this long-standing tradition of the theory of the four humors. Okay? Some of you might be familiar with this already, especially if you've talked to me at length outside of this environment about medieval medicine, because I can't stop talking about it. So the four humors correspond to the four elements, and your personality is determined by the balance of these four humors. So the four humors, the humors themselves are black bile, yellow bile, phlegm, and blood. Okay? And everybody has a combination of these things, according to the theory of the four humors. Some of us are dominated more by one humor over another. Some of us are, kind of borderline, in one of these sectors. And the way that we present ourselves to the world is determined by how those humors are acting in our bodies. Okay? So black bile is associated with the element earth, right? It is a cold and dry humor. Okay? If you are cold and dry, you are a melancholic. Okay? Like Hamlet. Okay? Hamlet is full of melancholy. He goes around, he sulks a lot. He's very sad. Yes. The melancholic character is probably the least desirable character in medieval medical texts and in medieval literature. People who are described as melancholic are generally going to be the characters that you want to avoid. Okay? Fire corresponds to yellow bile. You're going to be hot and dry. The choleric person is going to be the person who has a very hot temper. Okay? Okay? This is yellow bile is also called choler. Right? So you think about cholera, right? Very coffee, hot type of disease, right? So hot and dry yellow bile makes you hot-tempered and makes you a little less desirable than the sanguine character, but much more desirable than the melancholic character, because you're going to be full of life and you're going to, walk around like a big man and be all tough and confrontational and things like that. Okay? Women can be choleric too, but usually it's guys who fall into that category in medieval literature. So air corresponds to blood, the humor of blood, and air is hot and wet. Okay? And the character who is dominated by this particular humor is the sanguine character. This is the most desirable character type in medieval literature. And when we get to medieval drama, yes, which we shall, before the end of the hour, probably the most recognizable sanguine character in all of medieval drama. Anybody got a guess who that might be? Sanguine character, dominated by blood. If blood is a desirable humor. Jesus, right? Yeah? He's the perfect character, right? He's the guy who walks around, he's all calm all the time, he's happy all the time, right? Until, the end. But he is dominated by blood, okay? Because the blood of Christ is, the kind of the whole point of most of medieval drama is to talk about the body and blood of Jesus Christ. Finally, in this quadrant, lower quadrant here, we have phlegm, which is what I'm being dominated by right now. which corresponds to water, right? So phlegm is cold and wet. Most women in medieval literature are phlegmatics, okay? They're thought to be cold and wet characters, and they can't really do very much, and they're kind of limp and sad and weak, right? Okay. So not very positive characteristics go along with the phlegmatic character. So the two least desirable characters in most of medieval society, based on the four humors, would be the melancholic and the phlegmatic. Then we have the choleric, who's more aggressive and assertive, but tends to have a very hot temper. And then finally we have the sanguine character, who's all sunshine and bubbles. Okay. All right, so what we have been talking about in the medical illustrations is the fact that bodies need to be examined. That's how you figure out what's wrong with somebody or what's right with somebody. Okay? That's how you determine the health status of any individual, is by examining the body in depth, okay, and in detail. So what we have in this illustration, in the lower 6 panels, we have people being examined of their wounds, various wounds. These are kind of gruesome, in fact. I mean, this guy's intestines are coming out, and this guy's got arrows, he's got arrows sticking out of his chest. This particular guy's taking a bath, but he's got ulcers, ulcerated sores going on there. Not sure what's going on with this guy, but we seem to have a lot of kind of open, separating, lovely wounds there. And then this guy's got some mysterious rash. So we're looking at these characters and trying to figure out what's wrong with them. And what we see at the top are 3 different stages in the crucifixion of Christ. In just a little bit, I'm going to explain what those 2 things have to do with each other. Examining the wounds of patients and looking at the wounded body of Christ on the cross.
Does it all look like they're being examined by women?
Oh no, they're just practitioners with little hoods on. It's part of the gown of the medical practitioner. They didn't understand about germs the way that we understand, but they did think that maybe it wasn't such a good idea to have your hair falling into an open wound. So they at least understood that much about sanitary conditions in medical examinations. But that's a good question. Yeah, it's just a gown for the practitioner. Okay, so one of the things that we need to do in looking at medieval bodies in pain is, if someone has a wound, we need to examine it to the point that we're actually going to palpate it. Does anybody know what this particular picture is representing? Thomas? It is actually Doubting Thomas. Yeah, so here's Thomas sticking his finger in the wound of Christ and palpating the wound. He's examining the wound to determine whether or not it's real, right? Is this really Jesus Christ? So as we saw from the previous illustration, we're going to look at and touch those wounds, and this is no exception.
Who's the artist on it?
Caravaggio, yeah. So this one's actually a Renaissance, yeah. So snuck it in there, yeah, it's all right. No worries. So this illustration is of, this is called the Wound Man, okay? And this is a type of illustration that becomes popular in the Middle Ages and becomes even more popular during the Renaissance. And that is to show a human body that has been violated in any number of ways. And the purpose of this in a medical illustration or in a medical text would be to say, okay, these are all the possibilities, right? These are the most common possibilities for wounds. I'm not really sure how the scimitar thing on your shoulder is a common type of wound, but apparently it is. And then the text would go on to explain how to treat these particular types of wounds. So we can see in this case we've got an arrow that's been broken off. You know, what do you do with that if you can't grab it by the shaft and pull it out? The head wound is quite gruesome. I'm not really sure what's going on there, but you can see that this guy's obviously been violated in a number of ways. This is not meant to be an illustration of one guy getting, basically overkilled, right? This is to demonstrate just all the possibilities of wounds. And so we would look at those wounds, we would palpate those wounds, and then we'd figure out how to treat them. Okay. So, now, we've been talking about medical stuff for quite some time. What the heck does all of that have to do with medieval drama? Okay. Probably some of you had forgotten that we were even going to talk about that. Okay. My claim is that because the dramas put the bodies on display in such gruesome detail and tried to show bodies being violated and opened up, tortured, all kinds of lovely things are happening. So medieval bodies on the stage, that there is a connection between the medical illustration in trying to show us all of the varieties of things that can happen to medieval bodies, and that becomes part of popular culture. Okay, so then when medieval drama puts those bodies on display, they're using similar techniques to display those bodies. Okay, and that this is part of just a larger trend that emphasizes the visual representation of bodies as a whole, but specifically bodies in pain. Okay, so flesh and fluids play a major role in medieval drama, as they played a major role in medieval medicine. Again, probably the most famous example of this would be in the Crucifixion plays. When we have, let's say in the York Crucifixion play, we have the body of Christ being stretched to fit the cross. He doesn't fit. Okay, so the soldiers are sitting there and they're pulling on him, and they're really getting into it. The whole play is really about the work of these soldiers trying to crucify Jesus. It's not really about Jesus at that point, right? It's all about these guys going, well, here we are again. We got another crucifixion to do today. Well, let's do it right, because we might get a bonus when we're done. Oh, look, he's sitting on the cross all by himself. Oh, but he's not going to fit. So then they start yanking on him, right? And what happens is we get a very vivid description of the sinews popping in his shoulders, right? Because he doesn't fit the cross. His arms are too short, right? The cross is too big. And we're watching these guys, and we see them working. We see them tugging with ropes and things like that, and they're going, wow, his shoulders sure are popping, and oh, wow, there's blood coming out, and all of that. We're not seeing any of that, right? We're just seeing the guys working. But then these guys, these soldiers, they say, well, he's on the cross now that they've nailed him on there and everything. We need to lift this cross up. So as they're doing that, they're going, wow, this guy sure is heavy, and I don't know that we're going to get the cross into the slot where the cross is supposed to go. But then it does go in, and they say, oh, wow, it slipped, and look at him fall, right? Look at the blood coming out. When that's happening, then on the stage, what we're seeing is blood spurting out toward the audience, okay? We're paying attention to that blood because it's in our faces. It's like a Gallagher presentation. Anybody heard of Gallagher? Yeah, okay. He hasn't been doing stuff recently, but he was known for doing kind of in-your-face comedy that involved kind of smashing watermelons and things like that, right? Where the audience, the people in the front row, would get really wet, right? You had to wear rain slickers to go to his concerts to see the comedy. The same sort of thing is happening on the medieval stage, okay? When we have the crucifixion of Christ presented to us, we have it presented in a very gruesome, very visual and corporeal way, okay? We're going to see that blood coming out of the side of Christ when they stab him with a spear in his side. There's quite a bit of information that we have about medieval drama and how it was put on by these various towns, and they talk a lot about the special effects, and they talk about wanting to make it seem very real. And one of the ways that they do that is that they give the Jesus actor a bladder of pig's blood, okay, so that when he gets stabbed, that blood's going to spurt out, and it's going to seem very realistic, right? So it's not just painted on stage blood, it's going to burst out, okay? So that's probably the most famous and obvious emphasis on fluids in medieval drama. But there's a lot more emphasis on flesh and fluids throughout. One example is the Croxton play of the Sacrament, which is kind of a weird story. It's about a group of young Jewish men who don't believe that the host, the communion wafer, is actually the body of Christ. Okay, so they want to test it. They want to say, well, okay, if that's really the body of Christ, we need to be able to make sure that it acts like a body. Okay, how are we going to do that? Well, they do a lot of different things to it. First of all, they steal a host, or they have one stolen by a guy who works at the church, and they pay him off, and he brings this host, and then they start doing weird things to it. They stab it. Okay, they say, well, if it's really the body of Christ, if we stab it, it's going to bleed. Okay, they stab it. They try to cook it. They throw it into an oven. They throw it into a vat of boiling oil. And when they do that, it does actually start to bleed, and it starts to suffer, right? And they're going, well, this is really weird. And they're trying to destroy it by the end of the play. We're about 3/4 of the way through the play. And one of the Jews who's doing this torture says, well, we're going to destroy this thing. We're going to put it in this vat and try to boil it, right? Kill it by boiling it. So he tries to do that, and then he can't let go, right? It's stuck, right? Like, what's the stuff that the sticky stuff that the football guys use? I don't know. What's that? Oh, pine tar. Okay, that would work. Yeah. Anyway, so it's stuck on his hand, and he can't get it off, and he's trying to get it off. And then, finally, the other guys are like, well, we'll make it happen. Well, what happens is the guy's arm comes off, okay, and it ends up going into the boiling vat and all of that. So the miracle of this play is that through all of this torture and everything, these guys realize that, in fact, it is the body of Christ, okay, and they convert, and then the guy gets his arm back, and it all works out. Yeah, okay. Nobody ever said medieval drama was realistic either, okay? I live in a fantasy world of, these strange bodies being presented in strange ways. But throughout this entire play, the emphasis is on the physicality of that host, right? It is in, the mind of the person writing the play and then the people watching the play, it is the body of Christ. And so it's going to act like a body, okay? It is going to suffer, it's going to bleed, it's going to sweat, right, when it's around heat. It's going to do all of the things that bodies do. And so the point of that is to emphasize the physicality of Jesus, okay? And that's something else that comes up time and again in medieval drama, that Jesus is a real human being with a real human body. So there's a lot of emphasis throughout the cycle plays on the ways that the body of Jesus conforms to what we would normally think of as human interaction. So he is subject to the theory of the four humors as well. Okay? He is a sanguine character, but he also needs to stay in balance, just as the other characters need to. So let's see, go on to the next one. And this is actually the last slide. This is from the town of Oberammergau in Germany. I had the great pleasure of going there this summer to see the Passion Play there. They have a Passion Play in Oberammergau that's been going on since the 1630s, which is technically the Renaissance, but it's in the text, it's very similar to the English cycle plays that talk about the last days of Jesus. And what they do in Oberammergau is every 10 years they put on, for the entire summer, the Passion Play. And it covers those last days of Jesus, and it's very dramatic, and it's very, very physical. When they show you the whipping of Christ, they make it look like it's really happening. If you sit in the front row, you will get splattered with stage blood. When they raise up the cross, you see the Jesus figure hang there, and they drop him into the hole for the cross, and you see him jerk, and you see blood spurt out. Some of these traditions have been with us for a very long time, and I think that what we can get out of all of these is just that medieval people valued not just the body of Christ as a human body, but they were interested in what bodies were and how they worked and how we could understand them better. And the way that they did that was through visual presentation, whether in dramatic form, live stage performances or in medical illustrations where we're trying to look at the interiority of the body and trying to understand what those things really meant. I guess that's about all I have for you in terms of the lecture side of things. If you have questions, I'm happy to take them. Okay. So are there questions? Anybody? Yes?
Can you talk a little bit about the much earlier understanding of the body in, say, the 11th and 12th century, particularly Arab medical schools, Salerno medical school, et cetera?
Okay. Yeah. A lot of what's going on there is that, that the medical schools on the continent are based in Galenic medicine. And I think that as a whole, the theory of the four humors informs a lot of that. They are working on trying to understand the human body without cutting it open, at least in the 11th and 12th centuries, in part because of the prohibition against that type of procedure that had been put on them by the church. As the medical profession starts to develop a little bit more on the continent, we get a lot more emphasis on the professional training of those doctors, of those practitioners. And that is something that I mentioned earlier, that the medical, that the dissection comes a little bit later to England. That also comes quite a bit later to England as well, the professional training of doctors. What we mostly have in England at the time, in the 11th, 12th, 13th, even beginning of the 14th century, is we have people that are getting trained on the job as opposed to people who have university training. And that is a major difference between continental medical practice and English medical practice. But I think that the theories are still basically the same, and they are based in Galenic medicine and then some of the Arabic medicine as well. Especially with a lot of what's going on with the bloodletting and urine analysis and things like that. Most of that comes out of the Arabic medicine. And that's certainly influencing what's going on in the university training on the continent. Does that answer your question at all? Or are you looking for something more specific than that? Okay, all right. Anybody else? Yes?
It seems to me that the medical stuff has evolved hugely,
Mm-hmm.
but the drama, the Passion of Christ a few years ago, seemed just like what you described.
Yes, it is. Very much so. And actually, I was looking for a clip earlier today. I was going to show a clip, not of the Passion of Christ, but from Jesus of Montreal, which is a movie from the, I want to say it's the mid-'80s, might be late '80s. But it's a story about a guy who plays Jesus in a passion play in Montreal. And it shows you several of the scenes from that passion play. And the physicality of that film is very gruesome. But it's told from the perspective of, you always know that this is the actor playing Jesus, and all of that kind of stuff. But in the film, he suffers some physical ailments as well and ends up sacrificing himself. Oh, I just probably gave away the end of the movie. But he sacrifices himself in some way at the end of the film, much like Jesus does. So he becomes his character. Unlike the Passion of the Christ, in which, we're watching it and thinking, this isn't a guy playing Jesus. It's supposed to be, once you immerse yourself in the story, it is supposed to be Jesus. But yeah, that's very gruesome, very physical, putting that stuff on display and trying to make you feel it. Part of that has to do with the tradition of affective piety, which, again, I wish some of my students were here right now, because this is something that we talk about a lot in Brit Lit and in the Chaucer class and things like that. And that is the medieval tradition of affective piety, in which you are supposed to feel the pain of Christ as he's up on the cross. The reason that we're watching all of this is because we're supposed to feel that pain. Right? It isn't just, oh, that happened, and isn't that nice? He sacrificed himself. It's, you feel actual compassion, right? Suffering with Christ. So there's a very strong tradition throughout the Middle Ages, especially toward the end of the Middle Ages, of trying to feel compassion for either Jesus on the cross or for Mary watching Jesus on the cross. So suffering with her or with Christ. So yeah, I think that the Passion of the Christ is very much related to what's going on in here. And there's a reason why people are still drawn to stories like that. I mean, I think it's very powerful emotionally. It isn't just an issue of whether or not you have faith that corresponds to that. I think it has to do with, wow, someone's actually suffering that type of pain, right? And I'm going to get immersed in that. That's a good question. Okay. Yes.
I'm struck by the parallels you've drawn between the investigation of Jesus on the cross and the investigation of the body. And I'm just sort of struck, is there almost a theological link between the body as something that's sort of the ultimate mystery at that point? They don't understand hardly anything about it. And the same as Christ on the cross, that's the ultimate mystery, that sacrifice of how can it be a human and yet
Sure.
die at the same time, and that there's somehow investigating the body is similar to that theological enterprise of investigating the ultimate mystery.
Right. And for the most part, the understanding both in medicine and in theology is that ultimately you can't understand those things, right? That there are some things that are beyond our ken, right? And one of the reasons why vivisection was outlawed first, but then frowned upon later on, was that the church felt that it wasn't right to look into the body in that way, right? The living body is sacred, right? It was fine to look at dead bodies, right? Let's dig up some criminals and look at them, look at what their bodies looked like. But vivisection, no. Why would you cut into a body with the purpose of looking into it to pry into those mysteries? So yeah, I think that there is a parallel there between the mystery of, well, how does it work that there's a man who's also God, and then how exactly is it that God makes our bodies work and function and live, right? At the same time, though, there's a tremendous amount of curiosity about how it is possible that Jesus could be truly a man. So there's a lot of emphasis in medieval literature as a whole on the ways that he was human, right? That he's born of a human being, that he has all of the bodily functions of a human being. There's a huge theological debate about whether or not Jesus was a fully functioning man, right? In all of the ways that a man can function, right? It's a big debate because, if he has to be fully human, then he has to be fully human, right? Everything has to function. And yet at the same time, that's disturbing for people to think about. Why would you want to think about the member of Jesus Christ, right? You don't, right? I mean, that's disturbing for people to think about. So I'm getting disturbed just thinking about it right now. Actually, and yet, again, I wish that some of my students were here because this is something that we've talked about. There's also, toward the end of the Middle Ages and into the Renaissance, an artistic sort of obsession with showing the erect penis of Jesus Christ as he's being deposed from the cross, right? That in death, the idea was that that part of the functioning of his human body was that in that suffering, he got an erect penis. And so when they took him off the cross, that's part of what's being shown in a lot of late medieval and early Renaissance artistic representations of the deposition. Okay? Some of those get destroyed later, crossed out or whatever, because people were offended by that. But it points us to this concern of whether or not Christ was fully human, up to and including the moment of his death. Okay? Other questions? We're really going to end on the penis of Christ.
No other
Okay.
questions? Let's thank our speaker one more time.
Adams State College. Great stories begin here.